Welcome to the latest edition of Women's Health Updates, covering breakthroughs in the past 2 weeks. Brought to you by LucidQuest. Clair Health announced an $11.6 million funding round to advance its jewelry-inspired wrist wearable, designed for continuous monitoring of estrogen, progesterone, LH, FSH, and PDG in real time. In related funding news, June Health raised $2.4 million Canadian dollars for its women's health benefits platform focused on fertility, menopause, and mental health services. The developments reflect ongoing investment in longitudinal monitoring and women's healthcare delivery models. FamilyWell Health launched the Menopause Hub, introducing resources focused on behavioral and mental health during perimenopause and menopause. The platform includes a free clinical white paper and a menopause behavioral health certification program intended for coaches and behavioral health professionals. The initiative aims to support screening, treatment initiation, and follow-up care in midlife women. EBSCO Clinical Decisions and AWHONN announced a partnership to strengthen point-of-care support for women's health, obstetric, and neonatal nursing professionals. Under the collaboration, AWHONN experts will review specialized content within EBSCO's dynamic health platform. The effort is designed to provide validated, evidence-based resources and support more standardized clinical practice. Nivi and MSD announced a collaboration to expand HPV disease awareness and cervical cancer prevention through an AI-powered conversational platform. The initiative will begin in India, Indonesia, and Thailand, delivering localized education, risk assessments, and referrals for vaccination and screening services. The program seeks to improve access to preventive care in regions with significant cervical cancer burden. 6-year follow-up data from the Phase 1 GARNET study showed that Dostarlimab continued to provide durable benefit in patients with advanced or recurrent dMMR MSI-H endometrial cancer. Investigators reported sustained responses, deepening complete responses over time, and no new safety signals. The long-term findings further support the role of immunotherapy in this patient population. Interim results from the BEHOLD-1 study demonstrated dose-related confirmed response activity for Mocertatug rezetecan, a B7-H4-directed antibody-drug conjugate in platinum-resistant ovarian cancer and recurrent or advanced endometrial cancer. Based on the findings, Phase 3 dose levels have been selected for both indications. The program remains an important ADC candidate within gynecologic oncology. Zymeworks presented new Phase 1 data for ZW191, a folate receptor alpha-targeting antibody-drug conjugate under evaluation for gynecologic cancers. The company reported activity in platinum-resistant ovarian cancer, including responses observed in both FRα-positive and FRα-negative tumors. The results add to growing interest in next-generation ADC approaches for difficult-to-treat ovarian cancer. Delphi Diagnostics announced publication of findings evaluating its Endocrine Activity Index, or EAI, in HR-positive, HER2-negative breast cancer. According to the analysis, EAI identified patients more likely to benefit from weekly paclitaxel-containing adjuvant chemotherapy. The findings suggest biomarker-guided approaches may help refine chemotherapy selection beyond recurrence risk assessment alone. Stay ahead in women's health research. Like, share, and subscribe for our updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.